Welcome to the Medication Administration Training for Hope Cottage's Foster to Adopt program. My name is Jill Benefield, and I'm going to walk you through the next hour of training. At the end of this training video, you will complete the post-test and then receive your certificate of completion. For non-prescription medications and supplements, you must follow the label instructions for dosage, inform the child's prescribing healthcare professional of the administration and dosage of any non-prescription medication or supplements to ensure they are not contraindicated with any other medication prescribed to the child. You may give non-prescription medication or supplements to more than one child from one container. For prescription medications, caregivers must be informed about possible side effects of medications administered to the child, store all medication in the original container unless the caregiver has an additional container with the same label and instructions, administer all medications according to the instructions on the label or according to a prescribing healthcare professional's subsequent signed orders, administer each child's medication within 1 hour of preparation, ensure the child has taken the medication as prescribed, ensure a person trained in and authorized to administer medication administers the medication to a child in care unless the child is on a self-medication program. Maintain any documentation provided by the healthcare professional on the administration of current medication. Not physically force a child to take medication. Ensure that a child is not given any medication or treatment except on written orders of a healthcare professional. Not borrow or administer medication to a child that is prescribed to another person. Not administer medication to more than one child from the same container. Only the child for whom the medication was prescribed may use the medication. Psychotropic medications are medications prescribed for the treatment of symptoms of psychosis or another mental, emotional, or behavioral disorder. They can be used to exercise an effect on the central nervous system to influence and modify behavior, cognition, or affective state. Psychotropic medications change the way chemicals in the brain, called neurotransmitters, send messages between brain cells through a synapse or crossing. Each psychotropic medication is used to treat certain target symptoms. Types of psychotropic medications include stimulants, antidepressants, antipsychotics, mood stabilizers, and anti-anxiety agents. Stimulants are commonly used to treat attention deficit hyperactivity disorder, or ADHD. Symptoms of ADHD interfere with functioning at school and in daily living and may include short attention span, inability to stay still, and being impulsive. Stimulants may be short-acting or long-acting. Short-acting means that the medications are quickly effective, but the effects do not last a long time. Long-acting means that the medication is slowly absorbed, but they will maintain their effects over a longer period of time. Some children need to take a short-acting and a long-acting stimulant to get coverage throughout the entire day. Antidepressants are used in children to treat symptoms of depression and other conditions. Symptoms of depression may include feelings of hopelessness or helplessness, loss of energy, changes in appetite, weight gain or weight loss, not being able to enjoy activities the child used to enjoy, and thoughts of suicide. Antidepressants may help with other conditions such as school phobias, panic attacks, eating disorders, autism, ADHD, bedwetting, anxiety disorders, obsessive compulsive disorder or OCD, post-traumatic stress disorders or PTSD, personality disorders, and sleeping problems. Selective serotonin reuptake inhibitors or SSRIs. These are one of the newer groups of antidepressants. SSRIs are often used to treat depression and other disorders in children. They are often used because they are safer than some of the older antidepressants if overdose occurs. Serotonin norepinephrine reuptake inhibitors, SNRIs, are usually prescribed when SSRIs have not worked. SNRIs are not usually prescribed to children, however they may be helpful in some cases. Atypical antidepressants. These are more often used to help children with sleep problems and to treat depression. Children who have been traumatized may have problems with sleep. These are usually safer for children than standard prescription sleep medications. Antidepressants may take a couple of weeks to work. Finding the right treatment may take trial and error. Always discuss side effects and concerns with your child's healthcare provider. A 2-week break may be needed after finishing one medication and starting another one. A child should never stop taking antidepressants suddenly. Your child's doctor will help you wean the child off the medication slowly. Discontinuing the medication abruptly can be life-threatening, triggering withdrawal symptoms and relapse of depression. Antipsychotics may be used to treat a number of conditions in children, such as psychosis, bipolar disorder, schizophrenia, autism, Tourette syndrome, and severe aggression. Each child is different, so a child may need to try different medications in order to find the one that works best. You should start seeing positive changes in 2 to 3 weeks, but it may take up to 6 to 8 weeks. A child should never stop taking an antipsychotic suddenly. This may cause fast changes in mood, agitation, aggression, nausea, sweating, or tremors. The child's doctor will help you wean the child off the medication slowly. The child's weight, glucose levels, and lipid levels should be monitored regularly by a doctor while taking antipsychotic medication. Atypical antipsychotics are second-generation antipsychotics. They were first developed in 1994. They are the most common antipsychotics used in children. These antipsychotics are less likely to cause movement disorders than the typical antipsychotics. Typical antipsychotics are first-generation antipsychotics. They were first developed in 1950. Typical antipsychotics are used less often in children. Mood stabilizers are used to treat children with mood disorders, such as bipolar disorder. Children with bipolar disorder have extreme mood swings, manic and depressive states. When children are in the manic state, they may be very active, talk too much, have a lot of energy, and sleep very little. They may also be angry, irritable, or feel overly self-important. Children in the depressed state may feel hopeless or helpless, have a loss of energy, have changes in appetite, gain or lose weight, not enjoy activities the child used to enjoy, or have thoughts of suicide. Some medications used to treat mood disorders are also used to treat seizure disorders. If it is used to treat seizure disorders, it is not considered a psychotropic medication. Mood stabilizers may affect the metabolism, liver, kidneys, and thyroid. Children taking Tegretol, Depakote, or lithium should have routine blood work. Levels are usually checked in the morning before the medication is given to the child. Anti-anxiety or tranquilizers are used to treat people with severe anxiety that interferes with their daily activities. Benzodiazepines are potentially addictive and are more commonly used in a hospital setting. However, they may be used to treat neurological problems in children, such as muscle spasms. Side effects are uncomfortable effects, such as stomach aches, drowsiness, dizziness, sleep problems, tremors, and weight gain. They may occur when starting a new medication, increasing the dose, or stopping the medication. These may get better with healthy diet, rest, and exercise. These may make the child feel very uncomfortable, or the side effect may interfere with functioning, and the medical consenter should call the child's doctor and seek advice if this happens. Adverse reactions are more serious than side effects. They are uncommon and unexpected, and are likely harmful if the child keeps taking the medication. They can be life-threatening. If an adverse reaction occurs, including an allergic reaction, immediately talk to the child's doctor and follow his or her instructions. Always talk to the child's doctor anytime you have a concern about how a medication is affecting a child. Always report adverse reactions to the doctor right away. Call 911 or immediately take the child to the emergency room if the child is having an adverse reaction that is life-threatening. Remember to report this information to Hope Cottage and CPS. Informed consent. For children not in DFPS conservatorship, a parent or legal guardian may consent to using psychotropic medications. For a child in DFPS conservatorship, the child's medical consenters are legally authorized to provide consent for psychotropic medications. Medical consenters include the foster parents, CPS, and Hope Cottage case manager. Medical consent paperwork is signed at the child's placement. Information needed for informed consent. The healthcare professional must obtain informed consent from the child's medical consenter before prescribing a psychotropic medication. The medical consenter must be able to ask questions and receive the following information: the specific condition to be treated, the beneficial effects on that condition expected from the medication, the probable health and mental health consequences of not consenting to the medication, the probable clinically significant side effects and risks associated with the medication, the generally accepted alternative medications or interventions, if any, and the reasons for the proposed course of treatment. Procedures of informed consent. Informed consent must be obtained from the medical consenter for each new medication and for changes in dosage. A signed psychotropic medication treatment consent form, DFPS Form 4526, is required for each new psychotropic medication. The medical consenter must provide completed Form 4526 and psychotropic medication treatment consent to CPS as soon as possible or within 5 business days. The medical consenter must also let the CPS caseworker or supervisor know about the decision to consent to the medication, dose changes, or the decision not to consent by the next business day by email or other written communication. If the medical consenter is not sure whether to consent to the medication, they should discuss their concerns first with the prescribing medical provider and then with others involved in the case, such as the CPS caseworker or the Hope Cottage case manager. Texas law requires the medical consenter for a child in foster care to ensure that a child prescribed a psychotropic drug has an office visit with the prescribing healthcare provider at least once every 90 days. This allows the practitioner to appropriately monitor for side effects of the drug, determine whether the drug is helping the child achieve the treatment goals, and decide whether continued use of the drug is appropriate. If a physician has made a determination that there is an emergency according to Section 266.009 of the Family Code, and this emergency requires the administration of a psychotropic medication, then you must follow the physician's orders and do not have to obtain consent prior to the administration of the medication. Within 72 hours after that medication has been administered, you must notify CPS. The physician's statement regarding the emergency and the prescription must be documented in the child's record. Techniques and methods of administering medication. Do not give broken or discolored medication. Watch to make sure the child takes the medication. Before administering medication, consider the 6 rights. Number 1, the right child. Number 2, the right time. Number 3, the right medication. Number 4, the right route, whether oral, eye drops, nose spray, or inhaler. Number 5, the right dose. And number 6, the right documentation. Schedule II medications have a high risk of abuse, potentially leading to severe psychological or physical dependence. Examples include Ritalin, Adderall, Demerol, Vicodin, Dilaudid, and OxyContin. Medication storage and destruction. A foster home must store medication in a locked container, keep medication inaccessible other than to caregivers responsible for stored medication, store Schedule II medications under double lock in a separate container. A double lock can include a lock on the cabinet or filing cabinet and the door to the closet where medications are stored. Make provisions for storing medication that requires refrigeration, as these also must be in a locked container. Keep medication storage areas clean and orderly. Remove discontinued medications immediately and store it in a separate locked area until it is destroyed within 30 days. Remove medication on or before the expiration date and store it in a separate locked area until it is destroyed within 30 days. Remove medication of a discharged or deceased child immediately and store it in a separate locked area until it is destroyed within 30 days. Provide prescription medication to the person to whom a child is discharged or transferred if the child is taking the medication at that time. Caregivers must maintain a cumulative log recording all prescription and non-prescription medications and supplements dispensed to each child. The cumulative medication log must be updated within 24 hours of administering medication. Caregivers must maintain the medication log, including the child's full name, the prescribing healthcare professional's name, the reason the medication was prescribed or recommended, the medication name, strength, and dosage, the date, including the day, month, and year, and time the medication was administered, the name and signature of the person who administered the medication, the child's refusal to accept medication if applicable, reasons for administering the medication, including the specific symptoms, condition, and/or injuries of the child that the caregiver is treating. Medication administration continued. Each medication, both prescription and non-prescription, and/or supplements, require their own individual medication log, including the frequency of administration and the dosage given. Caregivers must document any prohibited prescription medications, for example, medication allergies or contraindications, or prohibited non-prescription medications and supplements in the medication log. Each medication log must be kept and filed in the corresponding child's file. Self-administration of medication. The child's parent must give written authorization for the child to be on the program. The child service plan must include the self-medication program and any requirements for caregiver supervision. The healthcare professional who prescribed the medication must be consulted and any concerns of the healthcare professional documented in the child's record. When a child who is on a self-medication program takes a dosage of the medication, you must ensure there is a system for reviewing the child's medication each day and that the child either records the daily dosage or reports the medication to the caregiver, who must then do the actual daily recording. Medication errors. A medication error includes but is not limited to the following: a child receives the wrong medication, a child receives medication prescribed to someone else, a child receives the wrong dosage of medication, a child receives medication at the wrong time, a medication dose is skipped or missed, a child receives expired medication, not following the medication administration instructions, such as giving a child medication on an empty stomach when the medication should be given with food, or a child receives medication that was not stored as required to maintain the effectiveness of the medication, such as refrigerating or not refrigerating the medication, or exposing the medication to heat or sunlight. What to do when a medication error occurs. If a caregiver finds a medication error regarding a prescribed medication, the caregiver must contact a healthcare professional immediately and follow the healthcare professional's recommendations. Always follow any and all instructions given by the healthcare provider. If a caregiver finds a medication error regarding a non-prescription medication, the caregiver must take the appropriate and necessary actions as required by the circumstances. If a caregiver finds a medication label error, the caregiver must report the error to the pharmacist and have the label on the medication container corrected as soon as possible, but no later than the next business day. Documenting medication errors. For all medication errors, a caregiver must document the following within 24 hours: the time and date of the error, which type of medication error occurred, the time and date of the call to the licensed healthcare professional, if applicable, the name and title of the healthcare professional contacted, if applicable, the healthcare professional's medical recommendations for ensuring the child's safety, if applicable. What to do when an adverse reaction occurs. If a child has an adverse reaction, an unexpected or dangerous reaction to a medication, the caregiver must seek immediate help for the child. If the reaction is life-threatening, such as a severe allergic reaction, call 911 immediately before calling your Hope Cottage case manager and CPS worker. For non-emergency adverse reactions, report the reaction to a healthcare professional, Hope Cottage case manager, and CPS worker. Always follow the healthcare professional's recommendations. Seek further medical care for the child if the child's condition appears to worsen. Document in the child's medical log the adverse reaction that the child had to the medication, the date and time of the call to the healthcare professional, the name and title of the healthcare professional contacted, and the healthcare professional's medical recommendations for ensuring the child's safety. What to do when side effects occur. If a child experiences side effects from any medication, the caregiver must immediately report any serious side effects to the child's prescribing healthcare professional, Hope Cottage case manager, and CPS worker. Document the observed and reported side effects, and report any other side effects to the prescribing healthcare professional within 72 hours. Casebook software and foster parent documentation. Foster parents will document all medication administrations in Casebook, the software system Hope Cottage uses for documentation. Casebook will allow you to enter new medications, medication administrations, medication allergies, medication errors, medication side effects, medication adverse reactions, and progress of medications. Adding new medications in Casebook. Go to the client's face page. On the left-hand side menu, click Medications and Allergies. At the top of the page, click New Medication to add a new medication to the client's record. Enter all applicable information for the medication and save. Slide 40. Recording administration of medication in Casebook. On the client's face page, on the left-hand side menu, click Medications, Allergies. At the top of the page, click the tab labeled Administer Medication. Select the medication you have administered. Enter your user profile and password and click Save at the bottom of the page. Always ensure that your signature appears after every administration. Recording a medication error in Casebook. On the client's face page, on the left-hand side menu, click Medications Allergies. At the top of the page, click Report Error. Enter all applicable information. Enter your user profile and password and click Save. Recording an allergy in Casebook. On the client's face page, on the left-hand side menu, click Medications Allergies. At the top of the page, click the tab labeled Allergies. At the top of the page, click the tab labeled New Allergy. Enter all applicable information and click Save at the bottom of the page. Medication documentation for babysitters. If a Hope Cottage approved babysitter has to administer medication during the time they are babysitting, they will need to use a Hope Cottage medication log, hard copy, to document administration of the medication. Foster parents will need to fill in the child's information and the medication information on the medication log beforehand and give it to the babysitter with instructions on administering the medication. The Hope Cottage medication log needs to be turned into your Hope Cottage case manager each month along with all other paperwork. You have now completed the Hope Cottage Medication Administration training. Next, you will complete the post test and then receive your certificate of completion. If you have any further questions regarding this training, please contact the Foster to Adopt trainer, Noah Buxt. Thank you.